Welcome to the weekly checkup on ReachMD for the week of December 21st, 2015. This week's news segment takes a look at genetics and cancer. While research has already made great strides in understanding the importance of personalizing cancer care by examining genomics of individual patients, emerging research shows that not all mutations are made equal. According to an oncology expert from the Johns Hopkins University School of Medicine, genetic analysis of a cancerous tumor can be misleading if healthy tissue samples are not also inspected, as these mutations may be present throughout the patient's genetic makeup and are therefore most likely benign. An interesting concept as the medical community moves forward on targeted treatments for cancer. To check out more programs on cancer therapies and similar genetic topics, head to ReachMD.com. ReachMD continues this month's focus on global medicine with a slithery segment on snake bites and venom treatments across the world. Hear from the founding director of the Global Snakebite Initiative in New Guinea as he discusses incidents, symptoms, and treatments for snake venom. And now for a quick look at some of our latest featured content. Venom isn't the only form of poison we are examining this week. States are now cracking down on physicians and pharmacies to curb prescription drug abuse across the nation. While these legislations are well-intentioned, they are also keeping necessary medications out of patient hands. Our latest episode of Everyday Family Medicine examines these statewide initiatives and whether they're doing a greater service or disservice to patients in the long run. This week's video highlight takes a look at type 2 diabetes. Join Dr. Brian McDonough and endocrinologist expert Dr. Tina Tatey in this Primary Care Today snippet.
Welcome to ReachMD. I'm your host, Dr. Brian McDonough, and today I have with me Dr. Tina Tatey. She is with Tulane University. She is an assistant professor of internal medicine, Department of Endocrinology, and we're going to talk about a very exciting topic, and that is type 2 diabetes, its management, and I think what's going to be great is that we'll be able to talk about some of the approaches to treatment of some of the different products that are out there, because it's getting somewhat complex for those of us in primary care. So welcome to the program.
Thank you very much, Dr. McDonough. It's a pleasure being here. So I, by all means, agree that, yes, obesity is a big problem. And, obesity is a risk factor for so many different things. Yes, we're all aware that it's a risk factor for prediabetes, for diabetes, but also realizing that it's a risk factor for, let's say, cholelithiasis, for sleep apnea, and, of course, arthritis as patients bear more weight. And also, there's epidemiological data and studies have shown that obesity by itself, even without going into prediabetes or diabetes, is a risk factor for chronic kidney disease.
For more featured content, head to ReachMD.com or listen in on iHeartRadio, iTunes, TuneIn, or Stitcher. On behalf of ReachMD, I'm Sherry Neely, inviting you to be part of the knowledge and wishing you a happy holiday season.